Is a heartbreaker an issue related to heart complications?
No. Majority of the problems related to lifestyle, or the diseases that come about related to lifestyle, which heart conditions is one of them, mostly it is caused by poor diet. My name is Dr. Susan Mburu. I am a medical doctor, a general practitioner, as well as a health center manager at AAR Healthcare Kenya. I am currently based at AAR City Center Outpatient Center.
Today we are marking World Heart Day, Daktari, and we ought to educate people out there regarding common heart complications and generally their heart health. What are the most common heart conditions would you say Kenyans face out there?
Mainly the heart conditions, we can divide them into two. So we have either what we call congenital heart diseases. So these are diseases that the babies will be born with. And then we have the acquired heart condition. So acquired means that they've happened to us over time, maybe based on certain risk factors that I'm sure we'll be talking about. So congenital mostly is around the valves of the heart, when the valves of the heart are not working well, or even when the heart was in the mother's womb, when the heart was developing. Yes, when the heart was developing, it didn't develop well. Maybe there are certain areas that of the heart muscle that didn't develop well, so that leads to congenital abnormalities. But majority of the heart conditions that we see nowadays are acquired. And these acquired ones range from one. You can have the commonest they are called coronary heart disease. Then it's also possible to have what is called heart failure. Heart failure just means that the heart is not performing its function as it should. Then the third common acquired disease is related to the electrical function of the heart. Because the heart has the muscular pump, it also has an electrical system, okay? So we call them arrhythmias, And arrhythmias is your heartbeat. So those would be the commonest. So congenital and acquired.
Acquired.
Yes.
Is what we acquire maybe knowingly or unknowingly. Do we have those we acquire unknowingly, maybe at your workplace? Talk about that a bit.
So unknowingly would most likely be related to things that we cannot change, basically, So for example, genetics can occur unknowingly. Then we have the things that we can be able to change, So like for example, what you rightfully said, our lifestyle, how we are living our day-to-day, what we eat, the kind of activity we engage in on a day-to-day. Nowadays, most of us live what we call sedentary lifestyles. We are not really having too much activity. Actually, these lifestyle-related risks is what is increasing the prevalence of heart diseases in our country today. And then lastly, one of the other ones that is acquired is stress. And stress leads to increase of some stress hormones in our body, For example, adrenaline. And when you have high stress hormones, so that causes the heart to function harder.
How can we be on alert to know that our hearts have issues? Do we have signs? Are there ways we can check at home before maybe we even come to the hospital?
Okay. Unfortunately, heart-related symptoms are not specific to the heart. Now, what we usually recommend, even if you're not sick, it's good for you to visit the hospital, even if it's once a year, where you come for a checkup, what we call a wellness checkup, so that we are able to get these conditions early and we are able to manage them early, which will lead to cure.
Based on your experience in the field, how accessible and affordable is the treatment of heart-related conditions in Kenya right now?
So heart treatment is actually a very expensive affair, because one, it utilizes very, high-tech machines, and also it takes quite a period of time, and then it also needs specialists who have studied for this, and we have few of those in Kenya. We don't have enough heart-related specialists to take care of all the conditions of the heart. We all focus on prevention rather than cure. How are we going to be able to prevent ourselves from getting there in the first place? Because the machinery to treat heart conditions, we don't have enough. Then again, the time period between when you actually feel something to possible death is very short. The specialists who are, taught on how to manage these heart conditions are also very few, and then majority of them are based in the large cities within the country, and yet we have a lot of people who have these heart conditions, even in the rural areas. So that also is another challenge.
What dietary should we adopt to ensure we don't inch close to the risk of heart diseases?
In terms of our diet, there's been a lot of change in the kind of foods that are easily accessible and that are available for us to use. A lot of high fat, high sugar diets, which are really not good for the heart, because what happens with the high fat diet, high sugar diets, they cause accumulation of cholesterol. Okay, so cholesterol in the blood vessels. We need to go back to having what is called a healthy, balanced diet. Number 2 is to ensure that we are eating all our meals. Our other problem is that we are too busy. So you find you skip breakfast, or you skip lunch, and then you eat a very hearty dinner. But what happens? Immediately you eat, you fall asleep. You are not going to utilize any of that energy that you're getting from that food. So it's again converted to fat. We need to take more water. So we need to take more water, 8 glasses of water a day. That helps in digestion, that helps in your body composition. Actually, majority of it is water, if you did not know. And then lastly is to exercise. All those diet and the physical activity, distressing, when you realize that you have an issue, seek support.
How does smoking and alcohol intake also contribute to these heart diseases? Okay,
so let's start with smoking. Smoking is also a lifestyle habit. And when we smoke, we're actually taking in toxins into our bodies. So that is not healthy. Smoking is not healthy in any way or form. Alcohol is the same. Again, alcohol is toxic to our bodies, it's toxic to our liver. There is no nutritional benefit for alcohol.
We talked about also, the other question was on compensating an unhealthy diet with a good exercise.
Now, actually, majority of the problems related to lifestyle, or the diseases that come about related to lifestyle, which heart conditions is one of them, mostly it is caused by poor diet. Actually, that contributes 70% of the problem, while 30% is from lack of physical activity. So you cannot be able to take an unhealthy diet and then go and exercise, because the kind of calories that you pack in when you eat an unhealthy diet, you definitely will not be able to lose all of it when you exercise. We only have one heart. We need to take care of it. And to take care of it, we need to really look at what am I doing as an individual, and to stop looking at what my friends are doing, what other people are doing, and think about yourself. What is healthy for you? And we've said through this conversation that the heart conditions that we have today, majority of them are caused by lifestyle-related complications, or things that we are doing wrong in our day-to-day living. So let's eat healthy, let's exercise, and let's reduce our stress levels. The 3 things that we need to do. Thank you.